gathered people only 22 in number. The time is already past 10, so we should start. Okay, as time going on, I think most of the students will join. Please, anybody can respond. Can you hear me?
Yes, sir.
जी सर.
Okay, we start the class now. As you are examining batch, you are going to appear in your final exams. I think in the coming year 2021 January for the session of November. So my initiative is to make you aware, make you understand the tips of SCQ answers, how you can prepare yourself for the answer of SCQ, and you can answer the questions in appropriate time, as there are short answer questions and you have to answer all the questions in a stipulated time. So you should have a clear knowledge of the answer of that questions, and not only that, you also have the tips how to write all the answers of the questions in a very short time, so that you can cover all the questions. For this, the better option is to discuss about the questions of SCQ of different fashions. And when I have discussed all the types of SCQ, you will get a clear conceptions of different types of answerhood of SCQ. So, first of all, before I go into a particular type of questions, I want to make a note of the tips how you can write a answer of SQ questions in a better way. What is the thing? This is when you are intended to write a answer of a short answered questions, you just make out the information that is given in your statement in a very short period of time. Like what is the age of the patient if it is a clinical scenario, and what is the duration of the symptom. This is the very much important things to deduce the right diagnosis. Sometimes you will get a questions where you are asked to write what is the diagnosis, and sometimes you are asked to write what are the differential diagnoses. So when the intention is only to write a single diagnosis, and if your first diagnosis is a wrong one, very reasonably the subsequent answers of the B or C will be wrong, and you will carry nothing by writing all SQ, and you have wasted so much time. So answering the first questions, what is the possible diagnosis, as it is in the question number 1A. So you have to write the single diagnosis, and it should be right one, because your examiner who are in the charge of your examining your written script, he or she has an answer key, and this answer key contained only one diagnosis, and you have to make your diagnosis as the diagnosis is given in the answer key. So when the single diagnosis is asked, then you should be very cautious to write down the single diagnosis. And for that, the duration of the symptoms, the age of the patients, and the other information that is given in the question should be analyzed together, so that a correct single diagnosis can be made. Sometimes it has happened that the possible single diagnosis may be 2 or 3, but your answer key has gotten 1, and you have to match this. So to understand this, you have to go through the statement very carefully. I repeat, you have to make the note of that particular age of the patient and the duration of the patient, so that you can pick a single possible diagnosis. Now, go to the example of the first question. It is a 30 years old male, again a 30 years old male, presented with fever with right-sided chest pain and cough for 7 days. So you look, the diagnosis depends on the duration. If patient has got a fever, unilateral chest pain, you have got the right-sided chest pain and cough. So these are the respiratory symptoms associated with fever. That is something there is infection is there. And what types of infections? It may be acute one, it may be chronic one. The duration is only 7 days. And patient has gotten 30 years old. So this respiratory symptom usually focused with an infection, and this is an acute one. And what are the findings here? It is most likely the diagnosis will be pneumonia. Right? Most likely diagnosis will be pneumonia, as the duration is only 7 days. Patient has got acute respiratory symptoms, and patient age is 30 years old male. So something chronic symptoms, and aged person, that comes to be other chronic problems, or the dreaded diagnosis like bronchogenic carcinoma is reduced there as the age is little less, and patient symptom is only for 7 days. So this is not the question, but these types of presentations maybe is for a bronchogenic carcinoma. It's possible, but the likely first diagnosis should not be like that. Again, tuberculosis, the duration is only 7 days, but when you are in the clinical session in ward, you may find the patient these kinds of acute problem later diagnosed as pulmonary tuberculosis, as the patient has got a low-grade fever for many months, but patient cannot mention that. They are not very much intelligent enough to spot their low-grade fever chronically held. They don't assume that this is a problem. But when there is associated any acute secondary infection, the tuberculosis patients comes to the ward with acute problem. But later, when patient sometimes is discharged with pneumonia treatment, and after that they are getting again ill, come to the ward again later, diagnosis pulmonary tuberculosis. So these types of dilemma may happen, but in case of written questions, you should not go through that dilemma. Rather, you assume the picture and make to relate with a typical presentations of a particular disease. So this is a typical presentations of pneumonia. So the diagnosis of what is the possible diagnosis. So most very likely, without any questions, without any hindrance, the diagnosis will be pneumonia. Then another thing is there. On examination, there was features of right-sided consolidation, and when the examining finding is there, these findings is very much notifying that these 7 days acute respiratory problem is associated with a consolidation. Most likely, this consolidation is pneumonia. Consolidation prototypically denotes pneumonia. So there is no doubt about it, the diagnosis is pneumonia. But when you are writing a diagnosis of any SCQ type questions, try to write in a complete one diagnosis. When you are telling this pneumonia, this is not complete. Okay. Rather, as the note is features of right-sided consolidation, if you put down the diagnosis is right-sided pneumonic consolidation, then this is a complete diagnosis of that particular statement, as there is findings of right-sided consolidation, and the statement given above goes in favor of an acute infection, pneumonia. Consolidation is for pneumonia. So when you incorporate all these informations to a single diagnosis, it will be right-sided mnemonic consolidation. This is a complete one, and I think it will carry the full marks. If any examiner notices your diagnosis like right-sided mnemonic consolidation, he or she, whoever may be the examiner, will understand that my student is very much intelligent one. Okay, so when you are writing a diagnosis of a particular statement, try to incorporate all the message that is given in your statement to the diagnosis. Then you will carry a full marks of that particular question. I think you will remember my tips in writing the short answer question. Enumerate the clinical features of the right-sided consolidation. So the intention of the first questions 1A is your analytical skill. How you can analyze the symptom, how you can analyze the examining information to a diagnosis. This is to judge your analytical power. Then second one is enumerate the clinical features of the right-sided consolidation. This is totally a knowledge-based question. How you have gone through the book, how you have gone through your clinical sessions in the world. So this is a bookish question. Enumerate the clinical features of right-sided consolidation. So you should write down systematically of the findings of consolidation, starting from the inspection to auscultation. Mind it, when you are putting the findings, you should mention the site as you are intended to write the findings of the particular patient and he has right-sided consolidation. So you should put the findings of right-sided consolidation, right side, the findings in the right side, left side, it is normal. It should be tabulated like that. Write down the marker of severity. Again, this is your clinical skill. How you can assess the patients of pneumonia in bedside. So this is to judge your clinical skill. We all know that in the pneumonia you have, I think, already gone through Davidson's, and it has a curve 65. That is the clinical tool. It is a clinical tool to assess the severity of the pneumonia. This is fusion, blood urea, respiratory rate, and blood pressure. 65 means age of the patients. So these are the clinical denominator along with blood urea to assess the severity of the condition. This is very right, but the marks given here is 1.5. I think there is anything more to be added to grasp the whole marks here. If you go through the Davidson's, you will have findings that severity marker, not only the CART 65. This is the CART 65, the quick assessment tool, so that we can assess the patient whether this patient should be treated in an observational ward, in the outdoor, or in the home treatment, or in the ICU, or in the ward. Is not it? But there are also some other features, other clinical features, or other investigational features to mark the severity. Look, just take for example, there is the CBC. If you have a high leukocyte count, very low leukocyte count, this is also a marker of severity. If you get the albumin of the patient reduced one, this is also a marker of severity. If you get in the X-ray, there is multiple lobe involvement, bilateral involvement, this is also a severity. If the patient has features of shock, this is also a marker of severity. If the patient has positive blood culture, this is also a marker of severity. There are so many points also is there. If anybody answers along with CAP 65 all the clinical other parameters of the marker of severity, he or she will get the full marks. Okay, so when you are answering the questions, if you consider all these things to make a complete one, to make a more relevant to the questions that is asked, and to add something little. When the question's intention is there, there is something to add more. These will carry full marks. As you know, in the SAQ, you will get some questions is very much familiar, very much familiar. This is about 75% of the questions of total. But in 25% of questions, there is something to just superconnect. So this is the minor things that you have to do. But common things should be addressed first. Then the super talent one. Okay, I think in the first questions, you have understand how we can write answers of that particular type of questions. And these types of questions are quite familiar to you. What is the possible diagnosis? Some narrative questions like features of right-sided consolidation, and some analytical questions, clinical questions, how to treat patients in a ward. So these questions are quite familiar to you. I think after my lecture, if you are attentive to that points, you can make it good answers. That types of questions. Okay. Is it clear to everybody? If anybody respond, uh,
Yes, sir.
anybody
जी
respond,
सर
it will be a pleasure
जी सर
for me that I can deliver it well to you.
जी सर
Nobody is responding.
স্যার আমরা শুনতে পাচ্ছি স্যার।
স্যার শুনতে পাচ্ছি।
চলে যাবেন কেন? বসেন। নাকি আউটডোর আছে? Now we are in the second questions. A 50 years old male was brought to emergency with high fever and respiratory distress. On examination, he was diagnosed and had clubbing. Again, you just consider the points. That is a 50 years old male. Okay, patient is in emergency. Then this is an emergency condition with high fever and respiratory distress. There is no duration of the symptom. You will find some questions in your SAQ where there will be no note of the duration. These types of questions are also seen in exams. In that case, on examination, you was diagnosed and clubbed. What are the differential diagnoses? Now, as this question is wide open, exactly, the diagnosis will be varied in person to person. Hence, the question is asked in the subtypes A, what are the differential diagnoses? That is, multiple diagnoses possible in that particular diagnosis. For example, if the 50 years old man brought to emergency with high fever and respiratory distress, if the information is like that, it can happen in a wide range of respiratory problems. It may be a bronchial asthma, it may be a COPD, it may be a bronchiectasis, it may be lung abscess, uh, whatnot. But on examination, he has cyanosed and clubbing. And in all the features, in all the conditions that are stated above, patient may be cyanosed. In bronchial asthma, you will not get clubbing. In the COPD, you will not get clubbing. So, this will be deducted from your differential analysis. So, if you consider this question, uh, if you remember the posology of the patients of febrile patients with respiratory distress, and if you consider all the diagnosis, 5 or 6, and in that, in which condition there are no clubbing, if you reduce that, then you can get the list of the differential diagnosis. So, patient has got high fever, respiratory distress, cyanosis, clubbing. Maybe bronchiectasis, yes. It may be lung abscess, yes. Respiratory distress, cyanosis, clubbing. Maybe a 50 years old male patient, 50 years old, older patients, maybe bronchogenic carcinoma. So these are the possible diagnosis. So this is the simple way